everyone. Today we will be learning everything about subcutaneous injections. As we all know that subcutaneous injection is an important part of administration of the drug as well as a very common nursing intervention in clinical area. Among all the different methods of drug administration, subcutaneous injection is the one which is applied into fatty layers of subcutaneous tissue just beneath our skin. As we all know, this subcutaneous layer contains some blood vessels, therefore it is important to diffuse the medication slowly at a sustained rate of absorption. As a nurse, it is our responsibility to administer this medication safely and properly and teach the patient and educate the patient about the injection technique. To administer the medication without pain and to avoid unnecessary complications, the nurse is required to have skills, knowledge about anatomy and physiology, psychology, as well as the communication skills. Let us now see the definition of the subcutaneous injection administration and the purposes. So the definition is, it is the process of administration of medications into the subcutaneous layer of the tissue. Purposes are to have a rapid and systemic effect of drug, for example insulin and heparin. Second is to have a local effect of drug, for example anesthetic, and third is to administer small amount of drug.
Here we are looking for the indications and contraindications of subcutaneous injection. The indications are severe dysphagia, oral, throat and esophageal lesions, profound weakness, intestinal obstructions, unacceptable number of oral medications, poor absorption of oral drugs, and unconscious patient. Contraindications are severe pain at the site of injection, swelling and bruising at the site of injection, thrombus formation, pulmonary embolism, skin irritation, allergic reactions, tenderness, swelling, restlessness, may be experience of soreness or bleeding.
Principle is of pharmacology. Various classes of drugs are given through injections such as remedial, preventive, diagnostic and so on. Insulin always administered by subcutaneous because insulin destroyed by digestive enzymes in the stomach. Next principle is of psychology. Explain the whole procedure to the patient to gain confidence. Clear all the doubts in simple language to relieve fear and anxiety. Comfortable positioning relaxes the patient. Next principle is of physics and chemistry. Pressure is related with all needle injection. When injection is drawn from an ampule, while in syringe the needle is put into the fluid and the piston is pulled back. Most important nursing responsibilities while giving the subcutaneous injection. First, follow 10 rights and 3 checks while giving the medication. Follow strict aseptic techniques for the sterilization of equipment in the preparation of medication in administration of the injection. Syringes should be airtight and needles should be sharp and patent. Always check expiry date of medication. At the site, especially for client getting insulin to prevent lipodystrophy. Use correct technique of injection. The needle inserted gently and quickly. The drug inserted slowly and needle withdrawn gently and quickly will be helpful to reduce the pain. Solution should be clear, sterile, nearly neutral in the reaction. Isotonic if possible, non-hematolytic. Expel air from the syringe before the injection. Injection should be charted immediately after it is administered by the person who has administered and shown sign it.
I am here to tell the purpose of administering subcutaneous injection. It includes preparation of patient, preparation of nurse, preparation of article, preparation of environment. So first, preparation of patient. Check the physician's order for the medicine, identify the right patient, explain the procedure to the patient to gain cooperation and to reduce the anxiety of the patient. Second, preparation of nurse. Nurse should be knowledgeable about the procedure. She must be confident and hand hygiene should be maintained. Preparation of environment. It includes adequate light and proper ventilation, as privacy should be maintained for the female patient mostly for administering the injection around umbilical region. And preparation of article will be continued by Harshada Adbai.
Try containing prescribed medicine to have the effect on body. Sterile syringe with sterile needle to inject the medicine. a pair of clean gloves to prevent the cross infection, dry cotton swab, and second bowl containing a spirit cotton swab to clean the injection site, a kidney tray to discard the wet waste, a paper bag to discard the dry waste, a marker pen to labeling the same with patient name, MR number and bed number, the hand sanitizer to prevent the cross infection.
It is the administration of medication into the subcutaneous tissue, layers of skin, epidermis, outermost layer of skin. Dermis is beneath the epidermis, subcutaneous tissue is being the deeper. Now we have to administer the injection into the subcutaneous tissue layer. Now coming on to the sides on the upper arm, 3 fingers below the acromion process. In this we have to include the outer lateral aspect of the upper arm. The abdomen from below the costal margin to iliac crest and more than 2 inches from the umbilicus. Side of upper hip or wrist line, anterior region of the thigh.
We have to check the name and MR number from the medication and from the patient's wristband that the hospital provides. Second right is right medication. Third right is right dose. Now we have to make sure that we are giving the right amount of dose. For example, it is really important to check how much units of insulin we have to give to the patient. Fourth right is right route. So we need to cross-check from the file which route the doctor has advised. Is it advised orally or via IV line, or is we have to dilute the medication? If it's a tablet, do the patient needs to swallow it directly, or we have to crush it and dilute it in water and then let the patient consume the medication? It is right time. We need to make sure we are giving the medication at right time. Do we have to give it 10 a.m. or 10 p.m.? Sixth right is right to inform. We need to inform the patient what we are giving to them. Ms. Shivani, now I am going to give you a medication called paracetamol, which is to reduce your fever.
I don't want medication. I just want to go at my home.
With that comes the seventh right, right to refuse. Now the patient doesn't want to take any medication, so I can't force them to take any medication. We can simply come back later and involve their family members to gain cooperation. Right is right assessment. Now after we have administered the medication, we need to monitor how the medication is reacting to the patient. The ninth right is right evaluation. We need to evaluate patients' response to the medication, which could be possible allergic reactions, etc. 10th right is right documentation. After we have done the procedure, we need to document it in nurse's notes, the medication we gave, the time at which the medication was given, the route via which the medicine was given, and the dose via which the medicine was given. So that sums up the 10 rights. What are the 3 checks? Basically, we have to check the characteristics of the medication, such as its color, its consistency, its color when we dilute it, out the medicine from the medicine cabinet is before we administer the medication to the patient. The third check is when we replace the medication into the medicine cabinet. Good evening, Ms. Shivani.
Good evening.
Did you eat well?
Yes, I did.
Next, I will perform the hand hygiene. That is, now for inserting the medication, I am using this purple colored 24 gauge needle. For representation purpose, we are using sterile water in place of the medication. By loading the medicine, the part where there is no label should face ourselves so that we can properly see how much medicine we are giving. Before injecting the medicine, we need to take a spirit swab and clean the insertion site in circular motion and discard this in kidney tray. Take a dry cotton piece, place it between your middle finger and ring finger. Now you will feel a slight pinching pain. You have to take a deep breath. Okay. Put the injection in 45-degree angle. Take a deep breath, please, Ms. Shivani. 45-degree angle, and then press the plunger in slow motion so that the patient doesn't feel pain. Take a deep breath, Ms. Shivani. Once you have done that, Now take the cotton that you are holding in your other hand, put it over the insertion site and pull out the needle slowly, and just ask the patient to hold the cotton ball over the insertion site. Cap the needle in your tray and discard it in pie dish. Now the important point to note in subcutaneous injections are that we do not aspirate in subcutaneous injection, and that we do not massage the insertion site like we do in intramuscular injections.
We discuss about the aftercare and documentation. First point is remove the needle from the syringe and discard in puncture-proof white container and syringe in a red bag. Second point is remove the gloves and discard in red bag. After removing the gloves, discard in a red bag. Then main part of the documentation is record the medication administered, the route, site and dose, and patient response on the nurse's notes with the site.